Hi, this is Sierra. I'm going to be using stuffed animals because my cat's way too mean and I'm scared to use my dog because she's older and I don't want to put unnecessary stress on her. So, for standing recumbency, you want to wrap your arm around the dog's neck, its head above the nook of your elbow, and wrap your other arm around the dog's abdomen and pull the dog closest to you. For lateral recumbency, grasp the dog's legs to gently guide it down onto its side using your body to support the dog. When laying on its side, place one arm over the dog's neck and apply pressure and grasp the legs, either grasping both legs with one finger in between the legs, or you can just grab the leg closest to the table. At the back, you want to place your arm over the dog's hips or bum and do the same thing with the legs, also applying pressure. For dorsal recumbency, you want to gently roll the dog onto its back. When the dog is on its back, point the front legs towards the dog's nose and the back legs towards its tail. This provides good access to the abdomen and chest cavity, and for bigger dogs, this will require 2 people. For sternum recumbency, the dog should be on its sternum. Again, wrap one arm around the dog's head. Again, its head resting above the nook of your shoulder, or elbow, and place one arm on the dog's back, applying gentle pressure. For cephalic blood draw, you want to remain in the same position and grasp the front limb using the arm on the dog's back. Grasp the front limb a little under the elbow. This will pop out the vein, and the dog's legs should be slightly off the tables to provide access to the veterinarian to draw the blood. Once the procedure is over, apply pressure to the wound to stop the bleeding. For jugular blood draw, the dog should be in the same position. Use one arm to wrap around the dog's muzzle, sometimes having to keep it closed, and point the dog's head towards the ceiling. With the other arm, control the dog's front legs, wrapping around them gently, and place them under the dog's nose. If done correctly, this should pop out the vein without any need of doing it yourself. Again, once the procedure is over, apply pressure to the wound to stop the bleeding. So for saphenous blood draw, you want the dog to be in lateral recumbency, and you want to apply pressure to the back upper leg just below the knee. Again, this will pop out the vein, and once the procedure is over, again, apply pressure to the wound to stop the bleeding. For lifting a small or medium-sized dog, again, wrap your arm around the dog's head, and your other arm, put it under the dog's bum with your fingers pointing towards the dog's head, and lift it that way, and place it where necessary, making sure not to use your legs and not your back. For the burrito technique, place a towel lengthwise over a table or a flat surface, and place the cat facing away from you if possible. Bring the front of the towel over the cat's neck towards the cat's head, and wrap the sides of the towel over the cat's back. Wrapping the cat tightly, but not uncomfortably. For a carrier, you want a carrier where you can remove the top. This just makes things way easier. For a non-anxious or nervous cat that's calm, things are relatively easy and you can just remove the cat from the carrier. For a more nervous or anxious cat, you can use the bedding to remove the cat with its bedding. If you don't have a carrier that has a top that's removable, you can use one arm and place it under the bedding in the carrier and gently guide the cat in with its bedding out that way. For an aggressive cat, you probably want more than one person, and sometimes sedation is needed. But you can use a towel and place it over the cat and lift it out with the towel over top the cat and the bedding under the cat. That's about everything. Thank you.